The COVID-19 response has demonstrated the importance of ensuring access to universal social protection. Ensuring that people can access quality health care while supporting job and income security are major challenges facing countries across the globe.
If there is a silver lining to the COVID-19 pandemic, it is how it has reconfigured policy mindsets and really opened a unique window of opportunity. And there are indeed some glimmers of hope in how the crisis could trigger a movement towards universal social protection. First, the crisis has underscored the primacy and the legitimacy of the state as bearing the primary responsibility and really having a duty to protect its citizens, and as the only entity that can act decisively using a range of policy instruments, including social protection measures, to protect people's health, their incomes, and jobs on a scale. Secondly, the social protection responses to the crisis have underscored the fact that both the working population and enterprises stand to benefit from a well-functioning social protection system, creating a common ground for the need to build stronger systems in a win-win situation.
Development partners are working together with national governments to ensure that social protection systems provide comprehensive, gender-responsive, and adequate benefits to assist those in need. In the Eastern Caribbean, 5 UN agencies are supporting the governments of Barbados and St. Lucia in strengthening their social protection systems, making them more adaptive and accessible.
COVID-19 has had significant impacts throughout the Caribbean. We've seen food insecurity rise to 2.7 million people, and at the same time we've seen job losses and income loss in around 63% of all households in the English-speaking Caribbean. Now what's concerning is that when we look at the lowest income households, that figure rises to 90%. This is where social protection is critical. So the United Nations SDG Fund, Joint Program for Social Protection in the Eastern Caribbean, is an important part of the puzzle. Governments around the Eastern Caribbean have used their social protection systems to expand and increase the level of support to people made vulnerable by the impacts of COVID-19. And the United Nations has been supporting those governments through this joint fund to help lead these countries towards a more universal and adaptive social protection.
The COVID-19 pandemic has provided an opportunity for countries to pivot, to quickly rethink and reshape their social protection policies to effectively respond to the needs of their citizens. While many countries have instituted emergency or temporary measures, others are re-engineering their social protection infrastructure in more permanent ways to ensure universality, gender responsiveness, and adaptability to future shocks.
We are ever cognizant of the impact of natural disasters on our poor and vulnerable citizens and how they can derail our social protection efforts. In light of this, we have activated our Disaster Social Relief Plan, which coordinates the distribution and expansion of social assistance aid in the event of a natural disaster. Being aware of our need to have an effective disaster social relief plan, we've been continuously working on upgrading our system. Most recently, we have conducted an extensive field evaluation of those persons who may need to be evacuated in the event of a disaster, both pre and post, given any vulnerabilities that they may have. Also, we have implemented a management information system which would allow us to have access to beneficiary information if a disaster occurs to make sure that they receive assistance quickly. In light of the COVID-19 pandemic, we also sought to have an electronic system put in place, and we launched a small-scale program called the Household Social Relief Fund, which makes payment electronically to beneficiaries' bank accounts.
So we have actually, that's the Ministry of Equity, has undertaken several social protection programs in response to COVID-19. We recognize the importance of that because really social protection speaks to programs and policies to help vulnerable persons. And you would recognize that as a result of COVID, a number of additional persons became vulnerable. So we have implemented several programs through the assistance of donors and partners. We were able to scale up vertically our Child Disability Grant Program. We were able to do the same for our foster care program, as well as our social assistance program for persons living with HIV. We were also able to expand our public assistance program horizontally. So as of now, we have actually expanded coverage of public assistance program by 1,000. We have moved from 2,600 on our list to now 3,600. In addition to that, we provided food hampers, we provided hygiene packages, and a lot of other different initiatives that the ministry engaged in to provide support and relief and assistance to individuals. I will not leave out the issue of psychosocial support. We believe that it is very important. And so through our Division of Human Services and through our in-house counseling personnel, we were able to also assist persons who were in need of psychosocial assistance. What are the opportunities that we have now? We are looking at how we reform our entire social protection system. We are looking at our delivery systems. We are looking at our coordination mechanisms. We are looking at our policies. And I will tell you that as of now, we have 2 consultants on board to review and update the National Social Protection Policy, as well as the National Social Protection Bill. Both of these documents were done in 2015, but we believe that it is important that these be reviewed and updated to ensure that they are shock responsive, to ensure that they take into consideration issues of gender as well as child sensitivity.
The OECS Social Inclusion and Social Protection Strategic Framework, which was recently revised and completed. We had a previous social development plan we were working from, but we've recently focused in on social inclusion and social protection. And so the key areas, the 4 key areas that we're looking at: social protection, building human and community resilience, facilitating social inclusion, and facilitating social reintegration. Building resilience includes infrastructure and all of those things, but from a social point of view, it's building human resilience. How are people able to cope? How are communities able to cope? So we need to build the resilience, yes, of our infrastructure, yes, of our systems, but also of our people and of our communities to be able to come together and cope in times of shock. Social protection is really about ensuring that people have the basics that are needed across the society. And so sometimes we think social protection is just about programs for persons who are most vulnerable or are at the edge. But really it's more than that. It's much more universal. So if you think about access to free education, for example, if you think about access to healthcare, for example, these are basic social protection floor mechanisms that allow everyone in society to have a base of health and education from which they are able to develop. And so it's a group effort, it's a team effort. We make sure we leave no one behind.